Okay, so this is going to be your guys' PowerPoint regarding preceptorship. We're just going to go over a few things that are required of you. If you have any questions, just contact me or Ashley afterwards. Let's get started. So as far as what is going to be covered, we're going to talk about your purpose of preceptor, guidelines, the calendar, and your goals. As far as the purpose of preceptorship, so it provides an opportunity for you to develop and master clinical and leadership skills to transition to practice as an LPN. So emphasis is going to be on leadership, collaboration, organization, prioritization, management of multiple clients, supervision, and delegation. This is going to be kind of a new experience for you guys. So number one, you're going to have management of multiple clients. In clinicals previously, you've only had one patient. In this case, you're going to have all of the patients that your preceptor has. So just make sure that you have some kind of tool to keep yourself organized through that. And then also supervision and delegation. So now that you guys are going to be practicing as the LPN, you're going to be in charge of people like your CNAs. So this will give you an opportunity to kind of start delegating and understand what you need to do to delegate. This is sometimes difficult for those of you that have already worked previously as CNAs, especially if you're working in an area doing your preceptorship where you work currently. You do need to just keep in mind that you're no longer the CNA. You do need to take the time to delegate those tasks, but still help and be friendly and do what you can. If you're not busy and you're, say, one of your clients needs help to the bathroom, help them do that. You don't need to just go say, oh, I'm going to go get the CNA. That's not my job. You guys are able to do that. If you're not crazy busy with meds or anything else, make sure that you are helping out where you can, okay? Requirements for preceptorship, at this point you guys should have already all had a minimum of 73% in the class. If you haven't had a 73, then you're ineligible to attend preceptorship, and in the end that means you don't meet the eligibility requirements to pass the course. Second part that you need to have to be able to go to preceptor and start your hours is you need to get at least an 80% on the preceptor quiz. This can be retaken multiple times to get that 80%. However, only the original score is going to earn you points. So say the first time in class you take it and you only get 60%, you're only going to get those 60% of points. However, you can come and retake it and get your 80 to go to preceptor. As far as responsibilities for your actual preceptor, so they're going to assist you in setting up your work days. When you first go and meet with them the first time and kind of do your orientation shift or meet with them just to do your calendar, they'll have their scheduled shifts and let you know what they are there for and what you can come and do, okay? They're going to need to orient you to the facility and their policies. They're going to plan and supervise your daily assignments. If any kind of injury occurs, you'll follow that procedure from that facility. However, they do need to make sure they're notifying us if that does happen. They're going to supervise you. They need to accompany you for all medications and treatments. You should not be giving meds or doing any treatments by yourself. Even if you get to a point that you feel comfortable, your preceptor still needs to be there with you when you are doing this. I cannot stress this enough. They need to make sure that they're reviewing and co-signing all of your documentation, whether it be computerized or if it's just paper documentation. Some of them, if they don't give you computer access, they'll let you chart on their names. So that is another reason they need to make sure they're reviewing what you're putting. And you cannot take or write any physician orders. If a physician comes to see a patient while you're there, you should go and see that doctor. However, if they start to give you orders, you need to make sure you tell them, I'm just a student, I can't do that, let me get my preceptor for you. Your preceptor does need to provide written feedback twice during your preceptorship. This is in your guys' comp book, and they will just need to make sure that they do this. Usually I say about the halfway point and then towards the end. They can do written feedback every day, and they should be giving you daily feedback every day just so that you know what you need to do. But just keep in mind that they're not necessarily required to do that. And then you'll get credit for your shift worked, not hours worked. So say that you have an 8-hour shift scheduled and you end up staying, say instead of 8, you do 10 hours. That still only counts as 8 hours. Your shift is what counts. Yes, sometimes you may end up there a little later to finish charting, whatever it may be. It's the same in the real world. It doesn't count towards your hours for the week. You basically are just going to be getting the 8 hours for that shift. So keep that in mind when you guys make your calendar. As far as student responsibilities, you're going to set up your clinical schedule with your preceptor. Again, this is going to be something you guys do that first time you meet. And then once you have your calendar set in stone for what you think you're going to do, you need to provide a copy of that calendar to your preceptor, to the facility itself, and then to WIT. So we will actually have that on our Canvas page, which we'll get to later. But you do need to make sure you're uploading that. As far as what your workbook says, your comp book, it does say no hours can be completed until your calendar is submitted. You do need to submit it, however, you do not need to get approval anymore. Once you submit your calendar, those are your hours, you can start those hours, okay? It used to be that you would have to wait for Kelly Flack to get back to you and say, yes, this is fine. That's no longer the case. So just make sure that you do have it submitted to Canvas before you start any shifts. That is the biggest thing you have to do. However, if on the test and quiz, if it has anything about doing the calendar and having it submitted and then getting approval, say yes for that answer, just because technically it is still that way in your book. However, we're not enforcing it anymore. Provide any documentation required by the facility. So if they ask for anything, like biggest thing you'll think of right now is a flu shot, make sure that you do provide information with them for that. There are places that have policies in place. If you do not have a flu shot, you might have to wear a mask the entire time you're there. If that's what you choose, that's fine, but you do need to make sure you provide them documentation showing that. You do need to notify your preceptor and WIT in case of any absence or change in schedule. If, say, life happens, you're sick, you can't go, that's fine, but you do need to be professional. You need to call the facility or your preceptor directly and tell them that you're not going to be there. And then you do need to contact WIT. So whether you contact your preceptor coordinator or if you contact myself or Ashley, either one is fine. You just need to make sure that you're notifying us. And then you need to keep in mind that no more than 2 absences are allowed that are based on your being absent. So what I mean by that is if you get to your shift one day and your preceptor is gone, but you talk to the facility and they have someone else you can work with, that is fine, as long as they have someone else willing to work with you. However, you yourself cannot call in sick more than twice. Also with this, you need to identify 4 professional goals. These will be uploaded into Canvas as well. You need to complete 64 hours plus an 8-hour orientation, which is a total of 72 hours. For those of you that are doing 12-hour shifts, you're going to have then 6 shifts plus an 8-hour orientation. Or if you're doing 8-hour shifts, you're going to have a total of 9 shifts. Okay? So just keep that in mind. Again, if you are there and you stay 10 hours when you're only scheduled 8, it still only counts as that 8 hours. It does not count as 10. If there's any incidences, again, follow the facility's procedures. However, you do need to make sure that we are notified. That is things such as like a needle stick, or if you have a fall, whatever it may be, you just need to make sure that you are contacting us. You will also submit 2 summaries, reflections of your own. These are pretty good to do at the same time as those 2 written feedbacks from your preceptor. So again, at 36 hours and then 72 hours, about halfway through, and then at the end. At the very end, you're going to evaluate your goals that you had identified previously and see how you met those or what your expectations were that maybe you didn't meet. It's not necessarily that you have to meet your goals, but just evaluate what you thought of those goals and what ended up actually happening. And most importantly, you're accountable for your own actions. So while your preceptor is in charge of you and they need to be watching you, you're accountable to make sure you're following the rules. You are the one that needs to be professional and say, hey, I know that you think I can go give this med myself, but I'm required to have you go with me. Hey, I think I can go do this nebulizer treatment, but I still need you to be there. You need to be accountable for those actions and making sure that you're following those. And then lastly, as far as the responsibilities of us at WIT, so a WIT nursing instructor will be there to visit you at least 2 times during preceptorship. The reason for the stars by this is those of you that do 12-hour shifts normally will only get 1 visit, just because you're not there as often. We usually try to get you about right in the middle and see where you're at. But those of you that do the 8 hours, you're going to have 9 shifts. We try to get there at least twice. The visits are unannounced. And then also when you see us come and visit, just be ready to discuss your goals, show us your competency book, discuss your experiences, etc. Again, it's going to be a WIT nursing instructor. It's not necessarily going to be myself or Ashley. It could be Kelly Flack. It could be Dawn or Carrie from your simulation experiences. It could be Brenda from the Denison campus. Just keep in mind that you're going to see someone coming to come visit you. It just might not necessarily be your instructors. As far as your assignments for preceptorship, you're going to be notified through our Canvas page of where you've been matched for your facility. At that point, that page that shows you where you got will give you contact information for the facility or your preceptor. So you need to then call them, set up your initial meeting orientation shift, and then further shifts at that meeting. Some of the facilities, they're doing it on a first come, first serve basis. So when you call, you'll be able to say, my name is so-and-so, I'm going to be doing my preceptorship with you for WIT. And they'll say, okay, this is the person you're with, this is the normal shift they work, and then they'll give you their information. Please, please, please do not contact your facilities before November 1st. They need time to know where you're going to be, and they need time to adjust and figure out who's all going where. So by giving them until that first day, you're going to have plenty of time to get your hours in. That gives them time to be ready for you. Especially those of you, if you got matched to a place you work, which there are a few, you need to make sure that you're not going to your boss and saying, hey, I got here for a preceptor. What do I get to do? What do I get to do? That's just going to make them less apt to take people that work for them in the future. So just keep that in mind. Wait until November 1st, then contact them and get everything set up. Once you've had that meeting, go ahead and complete your calendar and go ahead and submit it to the Canvas page. Again, so as I've said, preceptorship is going to be in a Canvas course. This is where all of your calendar, goals, summaries, etc. is going to be submitted. So just make sure that you have your access to that. If you're having any issues with that, make sure that you contact us right away. And then competency books. Similar to clinical, you're responsible for your own competency book. And I cannot stress it, you need to have this comp book at every preceptorship experience. It needs to be completed on a daily basis. You still need to be looking at those starred competencies, making sure that if there's something you're missing, that you maybe tell your preceptor in case they can maybe find that experience for you with someone else's patient. Just like clinical, you need to really seek those experiences and make sure that you're advocating for yourself to be able to get those all done and get eligible to pass the class. As far as thank yous, remember that your preceptor usually is not getting extra pay for this. They're volunteering to teach you. You're a guest in their facilities, especially, again, those of you that already work in those facilities. Yes, you work there, but you are a guest when you are there for preceptorship. They have made this opportunity available for us. You need to make sure that you're telling them thank you. Even when I was a student, I made sure to get my preceptor and the facility a thank you card. It's just respectful. It's something that teaches professionalism. It shows that you're happy that they gave you this opportunity and that you're happy to be able to learn so much from them. It's a big professional thing, especially as you go on. Myself, if I ever have a job interview, I happen to send a thank you to the people I interviewed with after every interview. It makes them remember you. It makes them feel like you care that they gave you the chance. So just keep that in mind. So in summary, just make sure that you're reading your comp book on pages 54 through 64. These are where you're going to find the information of what's going to be on the quiz. Again, if the quiz says anything about having your calendar approved before starting hours, you are going to say yes. However, that is not what we're enforcing anymore. But if it's on the quiz, you still have to answer that way just because it's in your book still. If you do have any other questions, just go ahead and ask myself or Ashley. You can also contact Kelly Flack. She is the division chair for nursing, and she usually has a big role in getting all of this preceptorship figured out. Otherwise, just have a good weekend and study hard for your preceptor quiz. Thanks.